Good evening, and thank you so much for joining us for this week's Community Leader Telephone Townhall. We're going to get started here in just a moment, but want to remind everyone as we let our fellow neighbors join the call that for the most up-to-date information and resources related to the district's COVID-19 response and recovery efforts, you can visit coronavirus.dc.gov. So again, I want to remind you of that site, coronavirus.dc.gov. We want to also remind you, as we are about to close out June and enter July, July is going to be a big month focus for getting responses for the census. And so if you've not completed your census, we hope that you do so ASAP. So you can do that by going to 2020census.gov, and you can respond to your census. So we hope that everyone will go to 2020census.gov, complete your census, because we want to make sure that all residents in the District of Columbia are counted. So again, that website is 2020census.gov. We'll get started here in just a moment. Thank you so much for being with us. All right, and thank you again for joining us for this week's Community Leader Teletown Hall. My name is Tomas Talamantes, and I'm Deputy Chief of Staff to Mayor Muriel Bowser. We want to thank you for joining us this week, and we're going to have updates for you from Dr. LaQuandra Nesbitt, from our Director of the D.C. Department of Health. Also joining us for the question and answer portion will be Director Christopher Rodriguez with our Department of Homeland Security and Emergency Management, and then we'll also hear from the Mayor. If you have any questions or would like to get entered into our question queue, you can do that now by pressing 0. Following remarks from Dr. Nesbitt, we will go into the Q&A portion of the program. So again, if you have any questions for the Mayor, Dr. Nesbitt, or Director Rodriguez, you can press 0 now to be entered into our question queue. And so without further ado, we're going to hear from Dr. LaQuandra Nesbitt. Dr. Nesbitt?
Hi, Tomas, and thank you so much for the introduction. I'm so excited again this week to be with all of our members of the community who have joined us again for another informative and town hall session where we look forward to taking questions. I continue to be enthusiastic about the leadership that Mayor Bowser has shown as we are still in a public health emergency and responding to the impacts of COVID-19 here in the District of Columbia. This past Monday, on June 22nd, we entered into the phase 2 of our phased reopening in the District of Columbia, which allows us to reactivate some activities in the District of Columbia. We do ask people to still be judicious in recognizing some of the populations in the district that do have an increased risk of vulnerability or increased risk of severe illness if they do have the opportunity to be impacted, unfortunately, by SARS-CoV-2, the virus that causes COVID-19. So while we have added more activities or opportunity for activity in the District of Columbia, including non-essential retail businesses being able to have patrons inside, or more personal care services like tanning, tattoo, waxing, nail salons reopening, indoor dining, restaurants are now reopening up to 50% of their capacity, gyms and fitness studios are reopening, and even some of our playgrounds have reopened across the city. And so those opportunities for increased activity are there. We put guidance on our website at coronavirus.dc.gov/phase2 to help people who operate those types of businesses, as well as members of our community who are going to be visiting those businesses, understand all of the precautions that we like you to be able to take so that we can continue to respond appropriately and keep the number of new cases that we have in the District of Columbia low. We do want to make sure that residents are reminded of opportunities for free testing that is widely available, and that anyone who believes they need to get tested should go and get a test. We have many opportunities on weekdays for testing throughout the district. These sites are open during the day and throughout the evening, and they are also open on Saturdays from 12 to 4. More information about the testing opportunities can also be found on coronavirus.dc.gov or by calling 1-855-363-0333. We also know that there was tremendous interest in antibody testing or free serology testing or screening in the district. DC Health launched that free serology screening in partnership with the Department of Forensic Sciences a couple of weeks ago, and we have are able to offer that to any district resident who is 6 years old or older. And right now we have a testing location in Navy Yard at Canal Park, which is open Monday through Friday from 9 a.m. to 3 p.m. And residents who are interested in accessing that testing can call 1-855-363-0333 as well. So we want to make sure that everybody has all of the information they need around COVID-19, and I'm sure the mayor would definitely want us to remind you all in non-COVID related news about the historic things that are going to be taking place in the district this week as it relates to, for the first time ever, the House of Representatives will pass our statehood bill to make D.C. the 51st state. So we all know that this has been something that the district has been working on. It's a culmination of years of hard work and organizing to build overwhelming support, not only in the district, but also to put D.C. statehood on the map as one of the most important issues facing our nation. It's not only about granting the 706,000 residents 2 senators and voting representation in the House, but this is also about our local autonomy and equal treatment under the law. This will be a moment to celebrate for all Washingtonians, whether you're a lifelong and multi-generational resident or whether or not you just got here. So I wanted to make sure that we put that on the radar for all of the people who are joining us today on the call. You may have the opportunity to ask the mayor more questions about the statehood initiative throughout the call later on in our town hall. But I and Director Rodriguez are more than happy to answer any of your COVID-related questions at this time. Tomas?
Thank you, Dr. Nesbitt, and thank you for the great reminder about the statehood vote this Friday, where we'll all be witness to history. So we hope that you all will, watch the vote, and as we celebrate, hopefully, the passage in the House. You share your support, your thoughts about what D.C. statehood means to you. Tweet at us at Mayor Bowser, #DC statehood. And I'm excited for the district to become the 51st state. So we will now go to Q&A. So if you have any questions, you can press 0 now, and we will be entered into the question queue. I do want to reemphasize with everyone all of the Phase 2 guidances, information related to Phase 2, as well as the copy of the mayor's order that the mayor signed that ordered Phase 2 to begin on Monday is available at coronavirus.dc.gov/Phase 2. So again, if you're looking for that information, it's Phase 2, FHASETWO/Phase 2. So our first question, we're going to go to Mary Ellen Sanders in Ward 4. Mary Ellen, your line is unmuted. Go ahead, Mary Ellen, if you can hear us.
Oh, hi. I thought somebody was going to talk for me. I didn't realize I needed to talk. I'm curious to know if the Tacoma Aquatic Center can be opened in some kind of phase so that those of us who are lane swimmers and not involved with activities on the sides of the pool but really just swim and go away, whether there's a way to factor us into opening the pool.
Thank you for that great question, Mary Ellen, and I can start with just an update related to our DPR pool facilities, and then Dr. Nesbitt can fill in with the public health guidance related to it. But we will be, not before July 15th, but beginning July 15th, we will be opening a certain amount of our outdoor DPR aquatic facilities, and so those are going to be remain to the outdoor facilities for lap swimming, as well as for swim lessons and things of that nature by appointment. For indoor pool facilities for DPR, I'll let Dr. Nesbitt just fill in about the pool guidance and why we're doing outdoor facilities as opposed to indoor facilities. Dr. Nesbitt?
Sure. The best available public health guidance we have at this time suggests that we should focus on the opportunity to provide district residents an opportunity to use our aquatic facilities that are outdoor. So we have been working with the Department of Parks and Recreation to focus on opening the outdoor aquatic facilities for lane swimming and structured pool activities such as swim lessons and some activities related to these summer camps that they will be providing the public additional guidance on. Tomas, you covered the rest of the DPR updates.
Thank you, Dr. Nesbitt. And we have a few questions related to apartment pools or condo pools that we can address really quickly. So those are able to open as of Monday, but have to adhere to guidelines from DC Health on how to safely open and how to safely operate. And so the guidance for apartment pools and for condo pools is available at the Phase 2 page on the coronavirus site. Gym pools are also allowed to operate, but have to adhere to the same guidance. So want to make sure that you look for any gym operators that are on the line. That guidance is within the gym guidance for Phase 2. Hotel pools remain closed as part of Phase 2. So that should hopefully answer the questions that we see in the queue for pools. Next, we'll go to our next question. So again, I want to remind everyone to be open. To press 0 if you have a question. We're going to go to our next question related from Jacqueline Mears. Jacqueline, your line is unmuted.
Thank you. This is for LaQuandra Nesbitt. Dr. Nesbitt, I want to know about hairdressing salons and what is it that I need to look for that they are doing or not doing in terms of safety with the COVID virus.
Sure. Thank you for the question. We have provided guidance documents for personal care services, including for cosmetology and barber services, and which began in Phase 1 of reopening, and now the additional services that will be opening in Phase 2. We have provided guidance that these services should be provided by appointment only, and for hairdressers, as you have described, or cosmetologists, they should only have one client in the salon at a time who is being serviced per stylist or licensed professional. So there is no ability for people to be waiting around, waiting to be serviced. There's also the need for them to wear personal protective equipment, and all clients who are in the salon should also be wearing a face covering. We are providing some additional guidance to them in terms of with specific treatments or services that individuals may be receiving, where there may be prolonged contact, that the use of a face shield in addition to a mask or face covering may be appropriate. So those are the types of things that we are recommending. I will go ahead and answer the question because we have received emails or have been asked questions that suggest that we should be instructing salons to not use hair dryers. And there is no recommendation that from a public health perspective that hair dryers and blow dryers should be prohibited in salons and barbershops.
Thank you, Dr. Nesbitt. We'll go next to Lauren Ritchie from Ward 6. Lauren, your line is unmuted.
Good evening. Thank you for the opportunity. As we are starting to see spikes in new cases in other states, has there been any, or is there going to be any consideration to some of the provisions that we're seeing, like with governors of New York and New Jersey, in terms of restricting out-of-state visitors?
Thank you for that question, Lauren. We'll go to Dr. Nesbitt, and I know Director Rodriguez is on the line as well, but Dr. Nesbitt?
Yes, so thank you so much for the question. We are closely monitoring the situation in other states, and I am a member. One of the things that we benefit from as being the District of Columbia is that we are a member of both state associations and large city associations, and so we have visibility into trends that are occurring both in the state, but also what happens sometimes is that the urban core, the large metropolitan areas that may be managing some of the trends and increases that are especially related to COVID-19 in those particular states. So we are monitoring very closely what is happening in those communities. As we were planning our phased reopening, we were very diligent, in particular, in terms of the types of activities that we would be making decisions to allow, or as we talk about turning the dial up and down in phase 2, that would be attractive for tourism in the District of Columbia. Many of the activities that are reopening, so to speak, in phase 2 are still very much geared toward our own residents. So we are very mindful of the balance that needs to be struck between activating more activities that would promote tourism and encourage people who are in those states that have higher rates of transmission than the District of Columbia currently has. We are also monitoring the need to activate any policies that would require, as you are referring to, a need for individuals to quarantine if they came to the District of Columbia for 14 days. If they are, in fact, from a community that has higher rates of transmission, those are the types of policies that tend to discourage people from those communities from visiting the District of Columbia and increasing our risk. We will continue, again, to monitor and make decisions in real time as to whether or not implementation of those types of policies are necessary.
Thank you, Dr. Nesbitt. We'll go to our next question. Ward Hoek in Ward 1. Your line is unmuted, Ward.
Yeah, okay, thank you. Dr. Nesbitt, I was wondering about the contact tracer program. How many people do you have contact tracing now, and how many more are you going to hire?
This is a question that I feel like we get on a daily basis. And we have a very fluid approach to onboarding and hiring more contact tracers. So we have hired and onboarded over 200 contact tracers, and then we have over 100 district government employees who have been detailed to contact trace. We are meeting our objectives of being able to contact new cases or making our first attempt with new cases within 1 day. That objective of over 90% is being met. Now, of course, that is not the objective that tells us completely whether or not we have gotten to a place where the pandemic itself is under control, et cetera, but it does give us some insight into the public health system capacity to respond and to be able to get in touch with folks. We are, of course, cognizant of the fact that as we have more activity in phase 2 and we have the potential for additional cases by virtue of having more activity and us still having a moderate level of community transmission, that we have the potential for more cases, and thus that's why we currently have 300 or so individuals prepared to do contact tracing. As you all have heard us say before, our request for applicants through the D.C. Department of Human Resources several weeks ago yielded thousands of applications for the initial 200 positions that we had people apply for. And so we intend to continue to recruit from that pool when we need to hire additional people. I do feel like this is a great opportunity for me to make clear some things where people may believe that because of some of the data we were reporting that we need volunteers for contact tracing. We are not recruiting for volunteers for contact tracing. However, we do still like to have volunteers in our Medical Reserve Corps for other things that we deploy people for in our COVID-19 response. We deploy volunteers to assist at our mass testing site. We deploy volunteers to help with some of our other data needs if they have skills in public health, but we are not meeting our contact tracing needs at this time with volunteers.
Thank you, Dr. Nesbitt. We'll go to our next question, Pastor Elston from Ward 4. Pastor, your line is unmuted.
Thank you, Dr. Nesbitt. I had a question about houses of worship in phase 2 in terms of the limitation on attendance for funerals and weddings.
Sure. This is a question that we've gotten quite a bit, and I will, go ahead and say here that I have gotten some of my own as a God-fearing woman whose faith is very near and dear to me. I have spoken with a friend of mine, Bishop Joseph Walker, on this topic, who is a presiding bishop of a particular denomination that oversees over 800 churches in the U.S. and abroad. And we have talked about this issue of holding houses of worship and places of faith to the mass gatherings requirement. And we had a conversation about this from the perspective of, the spiritual perspective as well as the logical perspective and the risk related to COVID-19. And where our conversation led us was back to the place where the public health perspective leads us, and we have had a very deep spiritual conversation that I will spare some of you on this phone. Some of you may email me who may be interested in it. I'd be happy to share. The risk of transmission, and there's been in what we call MMWRs published from the CDC, related to funerals, other family gatherings, and other celebratory activities such as weddings is very clear. And so we would be doing a disservice to our community if we made exceptions for those particular activities to exceed the mass gatherings requirement. And so while I appreciate the concern that people are expressing about the mass gathering requirement being held to those activities, both my own personal and faith convictions as well as my informed and educated opinion suggest that we should not be making decisions to move beyond that mass gathering requirement for those particular activities.
Thank you, Dr. Nesbitt. And as you all know, I love to remind you about the website on these calls. We do have, for places of worship, a full guidance available for you all that the DC Health team works very hard on different recommendations and guidelines for reopening safely for your congregation. So I just want to reemphasize that document. And all guidances are available at the coronavirus.dc.gov/phase2. We're going to go next to Nancy Harvin. Nancy, your line is unmuted.
Hi, good evening. Thank you for taking my question. What my concern is, particularly can you hear me?
Yes, we can hear you.
Oh, okay. As a DC government employee who works in a building that has public employees who come in and out and are very connected with the community, what are the protocols in place or being planned for us? Luckily, I'm home teleworking, but if we are asked to come back, what are the protocols in place for us to do so safely?
Dr. Nesbitt, Director Rodriguez.
Sure. So as a district government employee, your director of your agency has received a guide for reopening that provides them all of the information that will help them when it's time for you to return to work, or if you are currently working and not in a telework posture, all of the things that should be done from a facilities and a service delivery perspective. Just as all of the other employers in the District of Columbia should be planning for their employees who may be teleworking to return to the workplace, the district government has done the same. As a direct service providing organization, the district government, what we do is we serve people. So we are very cognizant in terms of how we do that. So there's a very comprehensive guide that talks about how we may need to modify particular buildings, how we may need to modify particular facilities. Just this week, when the mayor announced that the Department of Motor Vehicles would be offering more services, that announcement came with explaining that those services would be by appointment only. So again, there's a very deliberate process to be able to ensure that both employees and community members can receive services that reduces the risk of transmission for COVID-19.
Thank you, Dr. Nesbitt. We only have time for a few more questions, but I think there's a few questions related to SYEP. I can take the response there, which is a few of them are, is there an update for SYEP? Well, we were excited to announce earlier in June that SYEP would be moving virtually, and the program, which will run from June 22nd to July 31st, is a great new being, as we want to be safe and make sure that our participants have a safe but rewarding experience. We have done a virtual SYEP program where participants will be able to walk away with their first virtual telework experience while still earning their certifications in workforce development, and youth will continue to be paid on a successful completion of their modules. So we have virtual internships, virtual workforce development experience, career edge curriculum, and then there's a hybrid model for those youth aged 22 to 24. So all of that information is available on the DOES.dc.gov website, but we were excited we know how important the SYEP program is, and we were excited to continue that program in a virtual posture this summer for our participants. So I think that is it for the big questions for the call today. But I want to remind everyone again before we close out the call for this evening that we continually update coronavirus.dc.gov with the most up-to-date information with guidances and guidelines for phase 2 and how to safely operate. We also have downloadable posters for businesses. So if you want to, post about, proper mask wearing protocols in your establishment or social distancing, etc., we do have those available for you, and you can download those on the coronavirus website, and want to make sure that you are going to the page, and phase 2 has all the most up-to-date guidelines and things related to that. We will also want to remind everyone we'll have an update tomorrow as the mayor's daily press conference at 11 a.m., which you can watch online at on the mayor's social media platforms, as well as Channel 16 with DCN and Mayor.dc.gov/live. We'll have a daily update press conference tomorrow where we'll be providing updates on how to safely celebrate the 4th of July, because as Dr. Nesbitt has reminded us throughout the call, we are still in a public health emergency, so we want to make sure that residents are cognizant of how to safely celebrate 4th of July at home, and we want to really emphasize that it's, we have been able to open into a phase 2 this week. It is our shared responsibility to make sure that we are continuing in behaviors that will allow us to continue to see declines and get continue our phased reopening. But we need to make sure that we are sharing information with our residents and neighbors and our families about testing and the free testing sites that are available to you daily, and then all the guidelines and information on how to safely participate in any Phase 2 activities. So, Dr. Nesbitt, I don't know if you want to add anything else.
Tomas, I think that you've covered it very well, including some of the additional messages that people can look for from us in terms of how to safely and responsibly celebrate the holidays.
Thank you, Dr. Nesbitt. And a quicker website for everybody for SYEP is summerjobs.dc.gov. So thank you, Director Morrissey, who reminded me about that easier website. So it's summerjobs.dc.gov. We want to thank you all for being on today. We will have the same. We'll be here at the same time next week, same day, at 5 o'clock, and we'll hope you'll join us for the mayor's daily press briefing tomorrow at 11 a.m. And thank you all so much for being on the call. Have a good evening.